Elevated ESR? Get strategic. Hey everyone, welcome back to the channel. I'm Dr. Rezaian, a specialist in arthritis and autoimmune diseases. Before we begin, this video is for education and inspiration only. It's not medical advice. Be sure to consult a healthcare professional and double-check information with trusted sources. Today, we're cracking open one of the most common yet confusing labs in medicine, the elevated ESR. Let's turn that vague number into a targeted diagnosis. ESR, or erythrocyte sedimentation rate, is a non-specific marker of inflammation. It doesn't tell you where the fire is, but it lets you know something's burning. It can go up with infection, autoimmune disease, cancer, even anemia or pregnancy. So context is everything. When you see an elevated ESR, don't reflexively chase zebra diagnoses. Start with a clean structure. Confirm the elevation. Compare it with CRP. Use clinical clues to stratify. Categorize by cause. Order imaging only if it helps. Category 1, inflammatory and autoimmune diseases. Got joint pain, rashes, fatigue, think autoimmune, or FCCP. Don't forget ANCA for vasculitis or anti-GBM if you see hematuria with cough. Infection. Chronic infections love to elevate ESR. Think endocarditis, TB, or dissidus. CRP greater than ESR often favors infection. ESR greater than CRP suggests inflammation or cancer. Category 3, malignancy. If the ESR is over 100, rule out cancer. Anemia plus high ESR, think multiple myeloma. Check CBC, LDH, and free light chains. Category 4, chronic disease and metabolic conditions. ESR can creep up with CKD, diabetes, obesity, and anemia. It may be background noise, but don't ignore it. Category 5, viral hepatitis and cryoglobulinemia. Order Hep B surface antigen and core antibody and HCV antibody. HCV can mimic rheumatoid arthritis. Hep B can trigger polyarteritis nodosa. Imaging should match your suspicion, not just be a fishing expedition. Order a chest X-ray for TB or sarcoidosis. RI spine for dissidus. CT chest or abdomen for occult malignancy. Echocardiogram for endocarditis. PET CT for fever of unknown origin. Watch for red flags. ESR over 100 with weight loss or night sweats. Jaw claudication or vision changes, check for giant cell arteritis. Hematuria with hemoptysis, think pulmonary renal syndrome. Add labs logically based on the system involved. Check Hep B markers for vasculitis. HCV antibody for arthritis or cryoglobulinemia. ACE for sarcoidosis. Free light chains for myeloma. Anti-GBM for pulmonary renal syndrome. Here are the key takeaways. Repeat ESR and pair it with CRP. Use symptoms to guide your workup. Don't skip Hep panels, ACE, or paraproteins. High ESR alone is not a diagnosis, it's a signal. Refer to rheumatology when in doubt. An elevated ESR is like your check engine light. Ignore it, and you might miss something. Understand it, and it becomes your shortcut to diagnosis. If this helped, give it a like and share with your med circle. Don't forget to subscribe for more high-yield internal medicine content. Your shortcut to mastering inflammation starts here.